It might seem like high school graduation is pretty far away, but middle school is actually a great time to start thinking about a career. Do you know what you want to do yet?
I'm considering becoming a nurse. It's a great career choice.
I don't know much about nursing. What do nurses do?
Nursing is the largest healthcare profession in our state. Men and women who are nurses are leaders in healthcare. It's very exciting and rewarding.
Nurses are there when people are born, when people get sick or injured, and they take care of people as they get older.
No matter where they work, nurses not only care for the patients, but the whole family. By becoming a nurse, you'll get opportunities to make a difference every day.
Hi, Sam. I'm gonna give you a shot, okay?
Registered nurses in Washington State make an average of $67,000 a year, so you know you'll have a great, stable future.
Nursing might be a good fit for you if you're smart, organized, able to work well independently as well as a member of a team, good at math and science, a good communicator, at ease with technology, and are able to relate well to the feelings and thoughts of others.
As a nurse, you contribute to the health of your community. That quality of care makes a difference in someone's life by teaching them on discharge, by teaching them what to expect, how to anticipate certain things, by providing the educational tools that is needed. Nurses are teachers. It is a process of learning.
There's two ways you can start your nursing education. You can start with your associate degree in nursing at a community college and then go on to a university for a Bachelor of Science in Nursing degree. Or you can start directly at a university, get a Bachelor of Science in Nursing degree, and take the nursing exam. After you get your BSN, you can go get a master's degree, a Doctor of Nursing Practice, or a PhD.
Nurses' education teaches them about health and illness and how the body and mind work. They learn how to communicate with patients and families and how to manage other workers. After you graduate, you have to pass a test called the NCLEX RN. After passing, you can apply for a job as a registered nurse.
Would I work in a hospital?
Registered nurses work in healthcare settings all around the world.
Like schools.
In clinics?
And hospitals. Community health centers, research labs, offices, community colleges and universities, the military, jails and prisons, and many other places.
There's a job for just about every kind of nurse. That sounds pretty cool.
There's a lot of roles that nurses can be in our society. I'm a public health officer, and I'm doing that role. I've never worked a day in a hospital, and I'm a nurse.
Hello, Daniel. Hi, how are you? I have the Health Plan Finder telephone number. My role is, as a public health nurse, is to promote and protect and improve the health care of the community, involving families as well. It is the teaching aspect of public health nursing that I really enjoy.
As a flight nurse, I am a part of a team of a nurse, so there's two nurses flying, and we're called to transport patients. Every day is absolutely different. There's no planning on what your day is going to be. And you could be rushed off and you have to jump in a helicopter and you're flying over the Cascades and you're going to land. And I've done this. I've landed on the top of a mountain to take care of a guy who was having a heart attack.
There are actually some things you can do before getting to college to get started on the path to becoming a nurse.
Taking English, math, including algebra and geometry, science, including biology and chemistry, and physics, and computer science will give you a head start on your nursing prerequisites in college. You will have many math and science classes in college because you'll get to use that knowledge every day in your job.
Well, math and science, math definitely, especially in our neonatal intensive care unit. We have itty-bitty, teeny tiny babies, and it's up to the nurses to verify that the doses for medications are correct, which involves a lot of math.
Definitely in the prerequisites, there's statistics, which is involved heavily with math. There's anatomy and physiology and biology. So there's math and sciences involved, and a lot of that comes into play in your prerequisite classes before you get into a nursing program.
Here are some other helpful tools for exploring nursing as a career. Apply to attend a nurse or healthcare camp to try it on for size. Look for Health Explorer groups in your community. If you have a neighbor or relative who's a nurse, talk to them about their work and career. Ask what they like best, what did they find difficult, and what advice they have for you. Go on the Washington Center for Nursing website to see what you'll be able to do once you become a nurse. Talk to your counselor or college advisor about what classes you can start taking now, and check out these career resources.
Remember, now is a great time to start thinking about your future.
And you can really make a big difference as a nurse.
Take your first step towards nursing today.